What's going on, everyone? Happy Thursday. Hopefully everyone is doing well, staying safe, healthy. If you had to take a COVID test, hopefully you have tested negative. If you did test positive, I hope you have a full and speedy recovery with no long COVID issues. It is time now for the Thursday edition of the Virus Update for Thursday, October 24th, 2024. If you're new to my channel, welcome to my channel. You just clicked on to today's Virus Update. What is the Virus Update, you may ask? Well, I update on all those viruses out there that could make you sick. We talk about case levels, we talk about hospitalizations, deaths, we talk about the news of the day, maybe celebrities that are sick or sports figures. We talk about all that type of stuff. Why? Because COVID and other viruses are so underreported. You do not hear enough reporting on these viruses. People are going on to develop long COVID. People are still dying of COVID. And let's face it, COVID, it is just still such a big problem. And then there's a lot of risks that come with repeat COVID infections, which at this point, the majority of people have had COVID at least once, some having it many times at this point. Want to stay informed of what's going on? Subscribe down below. Give this video a thumbs up. Hit that notification bell. Share this video with anyone you know. And leave your comments down below. Already, there is an update from the CDC on the new fall and winter vaccine campaign. And there's a little bit of an update here. CDC recommends second dose of 2024-2025 COVID-19 vaccine for people 65 years and older, and for people who are moderately or severely immunocompromised. So yes, if you are 65 or older, or severely immunocompromised, or even moderately immunocompromised, CDC now recommends you get a second dose of the vaccine for this winter season. Alrighty, speaking of the vaccine, let's take a look at some data here that Mike Horger posted from the CDC. This is really interesting. He put, in the past 2 years, there has never been a time when 10% or more of U.S. dialysis staff were up to date on COVID vaccines. Never a point in time where over 10% were up to date. I mean, are you kidding me? COVID, the virus, can worsen or cause new diabetes problems. I mean, hello. It's just mind-boggling that healthcare does not want to keep up on vaccination. Now, he also put where he lives in Louisiana, only 1 in 150 dialysis workers are up to date on COVID vaccines, but it's terrible everywhere. New York, California, and even Vermont have low levels for the moment. This is just totally unacceptable. That I'm not saying there should be a mandate, but if you work in healthcare, you should be up to date on the vaccine, not only just for your patients. And I know someone's going to put down below, well, the vaccines don't stop transmission. No, they're not great at stopping transmission, but at the same time, I think you should try and keep yourself safe, and you should try and keep others safe too. There's another thing that we need to do. Vaccines plus masking is effective. All right, moving on. Totally ridiculous. Speaking of illness, look at this. Speaking of COVID, I should say, we don't know if this is COVID, but in the NBA, the new basketball season is starting here in the United States. Zion Williamson misses Pelicans season opener due to illness. Let's go down. There's a little bit of this I want you to see. He's not feeling well, Green said before the game. He has been sick the last couple days. It's just some type of virus. Are you kidding me? Okay, we have testing for viruses. We can test for COVID. We can test for flu A. We can test for flu B. We can test for RSV. We have tests out there. Test them to see if it's one of the viruses. Or are they just not allowed to disclose that information? That could be too, but it's ridiculous, all these excuses. It's just some type of virus. Unbelievable where we have come to. Alright, speaking of tests, blood tests confirm a second person in Missouri caught bird flu without exposure to infected animal, but obviously questions remain. You can read this whole story. I tweeted it out. I mean, I'm just going to leave it right at there with what the headline says. No connection to animals. That's concerning. That's very concerning, don't you think? Alright, here's one for you. Again, Just reading a headline. Sometimes that's what we do. Just read headlines. Fact check. Herd immunity is not the solution to COVID-19 pandemic. And I'm going to give you my version of this without reading the rest of this to you. Here's why herd immunity is not the solution. Back in 2020, who remembers the phrase, oh, we got to flatten the curve, we got to slow the curve? Didn't work. Okay, and then you had all these geniuses out there that said, well, if enough people get infected, we'll build up such a level of infections, the virus won't be able to survive. Okay, it's 2024, virus still exists. Guess what we found out early in the pandemic? Oh, no, you can get infected again. Yeah, still a thing. Then they says, okay, well, if everyone gets vaccinated and this happens and that happens, we'll have herd immunity. It won't be a problem anymore. Yeah. Hi, 2024 again. Coming to you from 2024. Yep, the COVID virus, it still exists. Herd immunity never happened. And now we're finding out about long COVID more and more by the day. We started finding out about it early on. Not many people really acknowledged it. If they did early on, maybe we would be in a better place now. We're finding out the big risks that come with a COVID infection. So, yeah, there's my answer. Herd immunity really is not the solution to COVID-19 pandemic. Again, I tweeted this story out, and you can read the whole story for yourself if you want to. It's just, I think everyone knows that herd immunity is not the solution. I mean, here you go right here. I have a whole studies in papers section. COVID's effects on the lungs. COVID's effects on the heart. The brain. Links to diabetes. Remember we just talked about dialysis a little bit ago. Long COVID studies. COVID's impact on the immune system. I mean, getting infected, that at one time we were led to believe getting infected would actually end this virus. No. This is a deadly virus that goes on to cause all these problems. Getting infected is bad. I mean, it has impact on the immune system. Taste and smell, yeah, that can still happen. It's bad for kids. It's bad for the variants. It's just ridiculous. And it even has an impact on wildlife. No, we don't need COVID for herd immunity. Let's just move on. National allergy map. 32% of the country in low to medium status. I don't see any orange on the map. A lot of green. Allergy levels, pollen levels are getting better, and who knows, we may be able to retire this for the season pretty soon. I'll still show it for another week or two. Let's take a look at air qualities. That's a different story. There's still these sporadic areas that have random bad air qualities. Today it's the southeast and the west coast, California. You still have problematic areas, but there is also a lot of green on the map, so that is some good news. Want to learn more about climate and weather? You can do that over on X and on Blue Sky. On X, it's Climate Data RPT. And then on Blue Sky, it's spelled out the full thing. Climate Data Report. You can also see my YouTube channel where I talk about the weather. I did a video today. We talked about the drought situation and the weather for the next 7 to 10 days. Hey, the models are still suggesting tropical season is not over. We got to pay attention to that. And of course, this drought, it's getting really bad. Severe drought has expanded more in the Mid-Atlantic region. If this continues, I think water restrictions are only a few weeks away. In other words, meaning maybe bans on washing cars, stuff like that. Yeah, if you live in that region and other regions in the United States, pay attention. Now this, I forgot to update for today, but they did, however, post an update and telling me to follow. It's because I'm logged into my other account. Hey, Climate Data Report. Remember I told you that is my place for weather. Anywho, this is the Wednesday, October update for Philadelphia EMS calls, and the Wednesday total yesterday was another 828 calls, so that's quite a few. Let's do a live look-in at what's going in on Montgomery County, Pennsylvania, here in the 5 o'clock hour on a Thursday. We do see, well, several bad calls. Cardiac emergency is showing up 3 times, I think, here. Yep, 3 times. And then we do see cardiac arrest, and we do see stroke calls as well. That's not good. There's a respiratory emergency call in Whitpain Township. So yes, there are some bad calls. Hopefully not as bad in Chester County. And we do see some problems there as well. We see respiratory difficulty. We see heart problems out in Elverson, Chester County. That's getting almost close to Lancaster area, which is Amish country. Yeah. So there's calls out there to be had. All right, speaking of Pennsylvania and all these different areas, take a look at the map here. This is the Pennsylvania wastewater map. And what you will notice here, there are a lot of wastewater sites now. It updated again today. There's a lot of wastewater sites that are no change. And I noticed that on a Tuesday update as well. There is one that is now listed as rising. That is in Dauphin County. That's the Harrisburg area. And then you see decrease in just only a couple wastewater sites now, but you don't see large increase. I got to tell you something. With these no change sites, I think a lot of them are about to flip to increase, because I was digging through the charts here and I was noting that a lot of these that say no change, this is a 15-day trend. On the shorter term, it's starting to go upward. So I think we may be on the cusp of seeing some more orange popping up. Center County, Pennsylvania, I do want to give some good news. You are still dropping at this point. Your summer wave that you had was one of the biggest waves ever, and I regret not listening to EMS calls more for Center County back during the summer. I didn't realize how big the wave was up there during a period before Penn State University students even came back. So, yes, Pennsylvania, I think we're starting to come near that turning point, because again, there's a lot of wastewater sites here that are on the very beginning stages of starting to rise. We do link down below all the different pages that I show here, and you can access this page for yourself. There's a link to it in that thread. All right, taking a look at what's going on in Canada. The COVID viral activity level is moderate. Flu A is low. Flu B is not detected at this time. And the viral activity level for RSV at this time is listed as moderate. All right, let's take a look at some more data here. The Walgreens national positivity rate is 16.2%. The prior week is 17%. And that's down by 0.8%. Total test, 4,551, prior week 5,249. You can see the drop is clearly slowing. It's probably going to level off, and within a few weeks, Walgreens positivity rates probably will start going up once again. All right, let's take a look at national wastewater levels for a moment, because there are a few things I want to point out to you. And first off, COVID continues to drop. Well, take a look at national RSV levels. Yes, they're on the rise now. And that rise is starting to become more significant. It's still listed as low, but should this continue, I think eventually it would go to medium levels. And I think at some point in November, we will see that happen. Probably going to see Halloween be a super spreader, not just for COVID. It will probably slow down this drop for COVID. It won't be the thing that goes makes it go straight upward, but for these other viruses, which did not have a summer season, yeah, I think they're going to really start to take off. And even influenza A, we're starting to see that increase now as well. Influenza B, not much going on yet. Oh, both influenza levels are still very low. HMPV is low. We've been watching norovirus, and take a look at this. Norovirus continues to rise. It is in the high category at this point in time. All right, let's take a look at a few individual wastewater sites, shall we? Can we take a look at DC? There used to be a site on this map where we could take a look at DC. Can't anymore. I wish we could. All right, Hollywood, Maryland. We see here that your COVID levels are listed at medium, RSV, influenza A, influenza B, HMPV is all listed low. Norovirus is coming up medium, but quite frankly, that looks a little bit higher than the national level, which was listed at high. I don't know. Make it make sense, but for the most part, yeah, your norovirus levels continue to rise. No mpox at this time, which is some good news. Let's do one more wastewater site. Let's go out to the West Coast, shall we? How about we go check in on Las Vegas once again? I want to see what's going on there. You can see Las Vegas, the COVID levels have flattened at the moment. They were starting to rise a little bit. Now they flatten a little bit. Not really dropping all that much or rising that much. RSV is low. Influenza A is low. Influenza B is low. And take a look at this. No HMPV issues, but norovirus, wow, really high. Maybe slowing off a little bit, but again, your norovirus levels have gone up. And we can see here hepatitis A has been detected. No detections of mpox at this time. All right, let's take a look at New Jersey for today, because the CDC data, the rest of it, will update tomorrow, and that should include some new variant data. So we'll get another update on what the level is of XEC. New Jersey hospitalizations, 241, 6 people on a ventilator, 34 people in the ICU, 39 discharges at this time, 740 people in New York State in the last 24 hours have tested positive, and in New York State for hospitalizations at this time, 586, 63 people in the hospital. We can see here that it looks like the hospitalizations, not the ICU number, but the hospitalizations has stayed the same, and 63 people in the ICU. So that 586 is the same number as yesterday. 63 is slightly less. Let's see here. Yes, slightly less than the previous day when it comes to people in the ICU. All right, let's talk about some more states. Let's do that data that we usually check up from CJS, who provides us with the data in the comments section of my videos. Thank you so much for doing this. It really is very helpful, and I'm glad that I can share what you find. All right, daily weekday reporting states. Florida, 466 new cases and 30 new deaths, which includes 1 from 2022. New Jersey yesterday, 454 new cases and 2 new deaths. New York, 427 new cases. And now we come to weekly reporting states. Arkansas reports 22 new deaths since their last death update 4 weeks ago. Arizona, 2,085 new cases, likely stemming from some kind of a case data dump. That does seem really high for them. And 11 new deaths reported. Colorado, 242 new positive tests, a test case positivity rate of 7.9% this week, and 20 CDC reported deaths. Delaware, 121 new cases and 7 new deaths, a high number for the first state. North Dakota reports 229 new cases. Nevada, 494 new cases and 2 new deaths. Oregon, 517 new positive tests spanning the past 3 weeks, a test case positivity rate of about 7%, and 41 new deaths over the past 3 weeks. South Dakota, 329 new cases and 7 new deaths. Tennessee, 1,964 new cases and 9 new deaths. Washington, 273 new state-reported hospitalizations and 26 new deaths. All right, let's get back to my browser here, and let's take a look at the weekly update from Ohio. Not much has changed in Ohio when it comes to cases. 3-week trend shows 3 weeks ago, 2,921, or over the last I should say 2 weeks ago, 2,921 cases. Last week's report, they reported 2,874 cases, and then this report, which would reflect last week's cases, 2,751 new cases. So, I mean, they're still dropping, but just not that much. I mean, I think they're down near the bottom at this point. Hospitalizations are trending down. Last week, they reported 138 newly added hospitalizations. And this week, another 108. See, people are still being hospitalized. People are still testing positive for COVID. It's like I said earlier in this video. Guess what? Herd immunity was not the answer to ending this pandemic. It was not the answer whatsoever. 3-week trend for ICU admissions. And we see here 4, 5, 6. So it's going up like a staircase. It's just gradually going up. Taking a look at the 3-week trend for deaths, and we do see that there are 18 reported deaths, which is a number that is down, and I should correct myself. That ICU admissions is not like a staircase. It's more like a ramp that's going upward. All right, one last state to take a look at, and that is Colorado here, and we do note there was a big drop in hospitalizations in Colorado. It was much higher. It's down by 52. It's now down to 84. So that is some good news. At least I think that's this week's number. They just switched their dashboard on us. Yeah, this is much different from last week's dashboard, and I don't think they're showing cases on here anymore. And we can also see the hospitalization count for influenza is 3, RSV 4, Positivity rate for COVID is down. It is 7.9%. Influenza is up. It's now at 2.9%. RSV is starting to rise as well, but that was a big increase for influenza. That was up by 2.17%. Alrighty, folks, that does it for the Thursday edition of the Virus Update. We will have another Virus Update again tomorrow. If you enjoyed this video, give it a thumbs up. If you're new, subscribe down below. Hit that notification bell. Share this video with anyone you know, and leave your comments down below. I will see you all again next time, which will be tomorrow. Until I see you again next time, stay safe, everyone, and have a fantastic Thursday evening. Thanks for watching.